Hello, my name's Kevin Gooden, and today I'll be discussing my paper titled Mental Health Issues Related to Opioid Addiction, Medical Opioid Use Correlates to Mental Health. Now, with the introduction of myself and the title of my paper out of the way, let me walk you through the key points I'll be covering today. The opioid epidemic is a significant issue, not just in terms of addiction, but also because of its strong correlation with mental health disorders such as anxiety and depression. This has critical implications for nurses and healthcare professionals. In the next few minutes, I'll discuss how this issue impacts society, explain the purpose behind my research, summarize relevant findings from the literature, and present a promising intervention that could help nurses manage these complex cases more effectively. Let's begin by looking at how opioid misuse and mental health disorders are affecting society at large. Opioid misuse, even when medically necessary, has devastating effects on society. Over 20% of adults who misuse opioids report mental health issues such as depression and anxiety, according to the CDC. The impact extends beyond individual patients to their families, healthcare systems, and society at large. The opioid crisis costs the United States over $78.5 billion annually, including healthcare expenses, lost productivity, addiction treatment, and criminal justice involvement. For individuals and families, the personal cost of addiction can result in loss of employment, relationships, and even lives. Healthcare professionals, particularly nurses, are on the front line of this crisis. As the first point of contact, nurses face increased emotional and mental strain when managing patients with co-occurring opioid misuse and mental health disorders. This exacerbates burnout, reduces job satisfaction, and increases the risk of nurse suicide, according to Davidson et al. 2020. I chose to focus on this topic and specifically use Davidson et al. 2020 because it addresses an alarming rise in co-occurring mental health disorders and opioid misuse. Given the opioid crisis in the United States, the need for integrated care approaches to treat both conditions simultaneously is crucial. The article also takes a novel approach by advocating cognitive behavioral therapy in conjunction with medication-assisted treatment, which shows promising results. The purpose of my paper is to explain how medically necessary opioid use correlates with the development of mental health disorders, such as depression and anxiety, and how these co-occurring conditions impact modern nursing practice. Nurses must be better equipped to manage these complex cases, particularly in identifying early signs of mental health issues and opioid misuse. By enhancing nurse education and promoting evidence-based interventions, the paper emphasizes the critical role nurses play in providing holistic care to patients with both opioid-related and mental health concerns. Nurses are at the forefront of patient care and need a deeper understanding of both opioid misuse and mental health disorders. Developing the skills to screen, assess, and intervene early is essential in providing effective care for patients with co-occurring conditions. Programs like SAMHSA's screening, brief intervention, and referral to treatment can help nurses identify early warning signs of both opioid misuse and emerging mental health issues, equipping them to intervene before complications arise. Despite increased awareness, a significant stigma still surrounds addiction and mental health disorders in the healthcare setting. This stigma often prevents patients from seeking care early. By improving nurse knowledge and fostering open discussions about opioid use and mental health, the healthcare community can reduce this stigma. Nurses can lead the way in creating supportive environments that encourage patients to seek help for co-occurring disorders without fear of judgment. A significant barrier to integrated treatments is the lack of resources, especially in underserved areas. Mental health professionals and addiction specialists are in short supply, particularly in rural areas. Additionally, stigma associated with opioid misuse hinders both patients and healthcare workers from seeking necessary care, according to the NIDA. Many healthcare providers lack training in managing co-occurring disorders. This knowledge gap can lead to suboptimal care for patients who misuse opioids while also battling mental health disorders, according to Hoffman et al. 2019. The need for integrated care directed me toward the intervention of combining cognitive behavioral therapy with medication-assisted treatment. This approach treats both physiological aspects of opioid addiction and the psychological factors contributing to mental health issues. The integration of cognitive behavioral therapy and medication-assisted treatment has shown significant success in reducing opioid misuse by 30% and improving mental health symptoms by 25%, according to Leung et al. 2022. This intervention has been successful in various healthcare settings, including outpatient clinics and inpatient care. To implement this in a nursing setting, nurses would need to undergo specialized training in both addiction management and mental health care. This could involve interdisciplinary collaboration with addiction specialists, mental health professionals, and social workers. Screening tools like screening, brief intervention, and referral treatment, SBIRT, could also be introduced in daily practice to facilitate early detection and intervention. Barriers include the stigma, lack of training, and resource limitations, particularly in rural areas. However, the use of telemedicine has been shown to improve access to mental health services in these regions, according to SAMHSA. Expanding access to telehealth for behavioral health consultations would allow patients to receive care without needing to travel long distances. Nurses play a critical role in addressing both opioid misuse and mental health issues. By receiving training in integrated care, nurses can better identify early warning signs of both conditions, improving overall patient outcomes. It also reduces societal burden of opioid misuse by decreasing relapse rates and promoting long-term recovery. In summary, opioid misuse and mental health disorders are deeply intertwined, and nurses are at the front line of care. By adopting integrated care approaches, such as combining cognitive behavioral therapy and medically assisted treatment, nurses can improve patient outcomes and reduce the personal and social impacts of opioid misuse. Moving forward, training programs that focus on managing co-occurring disorders are essential to empowering nurses and providing holistic care to vulnerable populations. Thank you for listening. Have a good night.